Hmm.
Alrighty, I'm recording this call now. This is the Aetna Medicare Advantage Southeast Texas 2026 insurance review. So good. So we were chatting here with Arlene and Donna. Some good questions that I'm gonna actually make some points to. The difference between an HMO and a PPO and what's being offered in Southeast Texas from Aetna. So there are some plan exits happening with with Aetna in Southeast Texas. If you're on an Aetna Freedom policy, which you girls are not, but then that's definitely going away. We have to move that policy. And then, yeah, I don't really think anyone else down there that I have on my book is on an HMO, because there's a couple of HMOs going out. So really all I'm going to do is go over the plans that are offered in Southeast Texas. And it's really, there's only 3. And there's only, okay, so there's 2 PPOs. The Value Plus PPO is remaining intact, and that's the plan that you girls are on. And then there are, yep.
I have HMO.
Oh, are you on an HMO?
Mine says PPO and hers says HMO.
Yeah, what's the name of your plan, Donna?
I know, I thought it was some kind of value plan or something.
It's Aetna. How did you get a card with HMO and I got a card with PPO? I thought we had the same thing. Okay, whatever.
Yeah.
You don't.
Okay, let's deal with you specifically towards the end of the meeting, because I am recording this for those that didn't make it for them to review later. But
Okay.
and I'll look up your plan and we'll take a closer look. But all right, so there's only 3 policies being offered. I'm going to go ahead and share my screen. In Southeast Texas, 2 PPOs, 1 HMO, and here's the deal: neither of the PPOs cover heritage. Actually, I need to look up one more thing. I'm sorry. Excuse me. Just trying to cover all my bases, and I think I might have failed just a smidge. Just give me a second. I got to back it up. Make sure I got some Houston. There's a Houston PPO happening real quick. I'm actually going to just pull this up so you can watch me do it. Anybody? 77058. Harris County. 6. Okay, yep. One. I'm going to have to download this one real quick. Hang on. Yeah, so this is just a strictly Harris County HMO.
You don't do referrals. Do you do referrals? I do referrals. That's
And had to do it.
Hang tight. This won't take a sec. And then I'll start going over the plans. So it's 1 HMO for Harris County. It's an extra. That is. Okay, here we got one for all of Southeast Texas. It's the extra HMO. Okay, we're gonna have to take a look at this one. HMO, all Southeast Texas. Did I do that right? No. No. Extra. Okay. One more. Hurry up. looking for a PPO that covers Harris County real quick, and then I'll be done and we can get into it. Just a reminder, I just got these plans on the first, so I'm learning with you. Value Plus, I already have downloaded. That's not in Harris. What is this? This is the only PPO that covers Harris County. Okay. Harris. Okay. Just take a look at one more and then we'll get started. Oh, yeah, that's it. We'll just make sure on this one here, Value Plus. Okay. So the bottom line is, just after looking at this, Harris PPO only. Value Plus. Anyways, the bottom line is, it looks like what Aetna's done is they've offered 2 PPOs for Golden Triangle area, 2 PPOs for Harris County only, and neither of them cover each other's regions. So if you live in Golden Triangle and you want to go to Houston and you're on a PPO, the only way that you can do that is by using your out-of-network benefits. Okay? It's vice versa. Not that I don't think anyone in Houston would want to go to doctors in the Golden Triangle. But that's funny. All right. So, and then the HMOs. So let me pull all this up. Let's first go over the HMO that covers all of Southeast Texas. Let's do that first. And that's this one right here. This is for 2026. So those of you that are on a PPO, take a look at these benefits, and then at the end of going over this particular policy, I'm gonna tell you why, if you want to stay with Aetna, why you want to consider moving to an HMO, and if you don't, then I'm going to go over the PPOs, one for Golden Triangle, one for Houston, 2 each, and then if you're not interested in any of these policies, you need to remember that I'm uploading all of my meetings for each carrier on my website. So I'm going to just go to my website real quick, show you where to go for that. Yesterday, I held Southeast Texas and Central Texas United Healthcare Medicare Advantage policy meetings, and they're pre-recorded. They're already uploaded to my website. But first things first, my website, yourtexasinsuranceBroker.com. Very easy, book consultation. That's easy to do. So you're going to hover over more, go to pre-recorded educational member meetings, and you're going to see a list of each carrier by either Southeast Texas or Central Texas. And you don't have to download anything. You just click on the link and go watch it. You can scroll through it, back it up, do whatever you need to do. So if Aetna is not to your liking this year, then it's going to behoove you to go ahead and take a look at other carriers. And of course, set an appointment with me so I can help guide you so it's not so overwhelming. I have to say this, even though this is an Aetna meeting. United Healthcare and Blue Cross Blue Shield. Okay, first of all, United Healthcare is not paying commissions on any PPOs. Humana is kind of a half thing. I won't get into that. Blue Cross Blue Shield is not paying on any policy. Blue Cross Blue Shield just bought Cigna. Cigna's been down in Southeast Texas, but up here in Central Texas, Cigna is inheriting Blue Cross Blue Shield's provider network. Doesn't apply to y'all. So lots of changes. If you want to remain my client or me your agent, then you'd have to stay on a policy that I am obviously going to remain getting paid on, and I'll be able to help guide you through that. And then you also have to do what's best for you. So I'm here to help guide you through the truth, and we'll figure it out. So booking an appointment is probably key. Alrighty, so the first plan we're going to go over for 2026, because there are some HMOs that are exiting. If you're on an HMO, you need to watch your mail or your emails from Aetna. They are going to send you a letter of termination for your policy for 2026, especially you should have already received it, or this week or next week, you're going to be getting it. So please pay attention to that. And then annual notice of changes if you're on a PPO currently, especially the Value Plus, whether you're in the Golden Triangle or Houston metropolitan area. Okay, so this is the new Aetna Medicare Signature HMO. It's called Signature Extra. This covers all of Southeast Texas. So let's take a look at the counties it covers. So it's a pretty good bit right here. So it covers all the way down to Brazoria, further north to Waller, obviously Harris County, and then Jefferson. So this covers all of Southeast Texas region. So that gives you a very solid network. We'll probably still have to look your doctors up and everything to make sure that this plan fits. On an HMO, you have to get a referral to see a specialist. That's there's two differences between an HMO and a PPO. The main one is you have to get a referral to see a specialist. The second biggest difference between an HMO and a PPO is on an HMO, you do not have what's called out-of-network benefits. So meaning it essentially on a PPO makes your network larger. So even if a doctor does not contract specifically with your plan, if you're on a PPO and you have out-of-network benefits and that doctor agrees to the terms and services of those out-of-network benefits, just meaning that they're going to bill you out of network, you are going to pay a higher cost, but it essentially widens your network. And so a lot of folks find that attractive, not having to get a referral and or having the option to use an out-of-network benefit on a PPO. So for 2026, what the trend is for 2026 across the board, regardless of carrier, is the carriers are wanting their client base to try to move from PPOs to HMOs. Hence, commissions are being taken from agent brokers, and they're just cutting plans entirely from the market, depending on the carrier, more specifically PPOs, because the agenda is to move their client base off of PPOs onto HMOs. Why are they doing that? It's really about data and audits. So the insurance carriers obviously audit what benefits members use. And if you're not using benefits, then they're losing money. They're not going to offer it. And so that's the gist. That's the logical gist. It's the most simplified gist that I can communicate in layman's term without getting into insurance jargon. That's the goal. So again, you can stay on your PPO if it's not exiting your county, if it's not terminating entirely. You can also look at another carrier. I'm here to help you do that. Here's another point that I failed to mention yesterday, just because there's so many changes. But if your policy is exiting any market or terminating for any reason, Medicare will give you what's called a special enrollment period. And it's a guaranteed issue to get on a Medicare supplement, also known as Medigap. These are the plans that are not HMOs and PPOs. That is what Medicare Advantage is. Medicare Advantage is nothing but an HMO and a PPO that has your drug plan tucked into it. A Medigap, or also known as Medicare Supplement, works together with Medicare. So you have two policies you have to purchase. You have to purchase a Plan G, which you will get guaranteed issue because your plan is terminating to get onto, and then you're going to have to purchase a separate prescription drug policy. So that's an entirely different route. And it depends on your financial needs on whether or not you can hang with the premiums for those policies. It depends on your age. It depends on your health status. But because a plan is terminating, you will get what's called guaranteed issue to get on a Medicare supplement. But there's a lot to that. It may or may not fit someone's needs. It's not necessarily the best route for everyone. For some folks, it is. So again, I encourage you to book an appointment with me so we can do a needs analysis and figure out which direction to go. All right, back to it. So this is the overall Southeast Texas HMO that's being offered in Southeast Texas, large network. It is a $0 monthly premium. Remember, you're always paying your Part B premium through your Social Security stipend. That is going up next year. It goes up every year. I need to pull up another document. I was a smidge unprepared this morning. I'm sorry. So your Part B comes out of your Social Security. In 2025, it was $185 for most people because it is based on your income. For next year, for 2026, it is going up to $206.50. So you need to watch any communication from Social Security regarding your Part B premium. And the Part B deductible is going up. This does not apply to, the deductible does not apply to Medicare Advantage folks. It does apply to Medicare Supplement. So that would be the Plan G, K, L. There's multiple Plan Medigap policies. This does go up. That it does apply to those folks. Okay, so anyways, this is the HMO for Southeast Texas. No monthly premium, no medical deductible. Maximum out of pocket is $6,750. So just to reiterate what this is, because a lot of people get deductible and maximum out of pocket confused. A deductible is something you would typically have to pay or meet in order for the insurance, for you to reap the benefits of paying a lower out of pocket cost on whatever benefit is offered within that plan. So you do not have a medical deductible on this policy.
That's cool.
Your maximum out of pocket is, in my professional opinion, the most important benefit that you know on your policy, because this is going to be your financial safety net. So if your copays actually reach $6,750 on this particular HMO, and it's just medical because the prescription drug portion is different. We'll go over that in a minute. Then Aetna will pay the remainder of your medical for that year, that calendar year. But you're not going to reach it. And you'd have to be severely ill. I mean, in and out of the hospital multiple times, multiple tests, just a tremendous amount of issues going on. But nonetheless, that is the most you'd spend medically annually if you were to have a very hypothetically bad year health-wise. So that is your cap on what comes out of your pocket medically. Your inpatient hospital stay is going to be $350 per day for days 1 through 5. So if you were in the hospital for 6 days or more, you are not going to be billed more than $1,750. So it's important to watch your statements coming from Aetna monthly, making sure that the billing is correct. If the billing is not correct, you need to first call Aetna Member Services, and then if they can't figure it out, I'm always here to step in and help mitigate further. All right, so outpatient hospital observations, outpatient hospital, and any kind of surgical. So this would be outpatient hospital, and this is surgery at a surgical center. So like a surgical center versus the actual hospital, it's going to be a little bit lower copay max at a surgical center versus at an outpatient hospital. You have a range. So the max you would pay for a surgery on this policy is going to be $250. The reason they give you a range is because it depends on the doctor's orders, the surgery that's being done, and the facility in which it's being executed. Yeah. So there's that. Primary care physician is $0. Specialist would be $40. You still get all your preventatives at $0. Emergency and urgent care looks like it's only domestic. It's going to be $135 for emergency care, $50 for urgent care. Okay, outside of the U.S. Here's the prices. It's 130, 310 for an ambulance. This is actually good. So if you travel, because there are some other carriers that have like a $5,000 max for worldwide emergency coverage, or 50,000. So this is actually a good number if you do travel abroad. Diagnostic tests and procedures are going to be a $50 copay. Labs, zero. Any kind of diagnostic CAT scans or MRIs are going to be a flat 300. And then outpatient x-rays, here's another range. So it just depends on the orders in the facility. And the max you would pay is $35 copay. Diagnostic hearing exam outside of your routine hearing exam is going to be a $40 copay. You get a hearing aid allowance of $750 per year. We'd have to stay within their hearing vendor. Okay, $2,500 worth of dental. First year, so it is, the dental looks like it, okay, the dental is a PPO, even though this is a medical HMO network. The dental portion of the policy is a PPO, which is mostly what dentists take. You have a $2,500 yearly allowance to meet, and your co-insurance is going to be anywhere from 20 to 50% out of pocket. There are some limited exclusions. There are things that aren't covered. So we'd have, if that interests you, as you can see right here, it says see evidence of coverage for details or exclusions and limitations. So it may or may not fit your needs. But you could get cleanings, you could get some certain things done, and you're not paying an extra premium for it. So that is positive. You also don't have a 1-year waiting period like most standalone dental policies do. It's not a total, I mean, it is of years. Okay, you always get your routine eye exam for zero. Outside of that, it's going to be 40, I believe. They do give you an allowance of $175 for eyewear, and it is annual. Mental health stays likened to the medical stays. Okie dokie. This is important. Skilled nursing facility. So if you were to get a surgery or have any kind of inpatient hospital stay, and while you have some sort of procedure during your inpatient hospital stay and the doctors deem that you need more help with recovery, they're going to send you to what's called a rehab, or, you know, the correct terminology is skilled nursing facility. You could be in there anywhere from a week to 14 days. You will pay $10 per day up to day 20. You are typically never in those facilities for more than 20 days, but if you are, it does go up to $218 per day for days 21 through 100. Okay, so any kind of therapy that you get, physical, speech, occupational, it's going to be a $35 copay each time. Ambulance is a $310 copay. Transportation is not covered outside of ambulance or emergency. Part B drugs remain the same, up to 20%. Insulin still remain a $35 copay due to the Insulin Reduction Act. Ooh. Okay, so here's the drug portion of this HMO. You'll pay the plan's negotiated drug cost up to the deductible limit of $615, and the deductible on this policy applies to tiers 3, 4, and 5. Okay, so don't forget that CVS owns Aetna, so CVS is clearly going to be a preferred pharmacy because you have preferred here versus standard, and you can see the difference in cost. But when it comes to tier 3s and 4s, it doesn't matter. It's across the board. You're paying 24% co-insurance for tier 3s, 25 for tiers 4 and 5. So you might need to do a review of what your hypothetical out-of-pocket cost is for your drugs for the year. Here's something else you need to know. Don't forget that Medicare sets the standard of what the insurance companies can charge you, but they do give, they being Medicare, gives the private insurance companies leniency. So everything goes up every year. Your Part B premium, your Part B deductible with original Medicare, your pharmaceutical deductible, and this is the pharmaceutical deductible for 2026 deemed by original Medicare. So it's $615. This year it was $590. So on this plan, oh, good Lord. There it is. They are using the deemed $615 deductible. On other policies, I'm saying it can vary. So there are some other insurance companies that have a lower, like around around 450 versus 615. So it can vary from one carrier to the next, one policy to the next. You will meet this. You'll pay that at the pharmacy. You'll meet it as you're paying your co-insurances to pick up your prescriptions. Also, another note, if you're out of pocket, your out-of-pocket costs for your drugs, your co-insurances or co-pays meet 2,100, then nothing should come out of your pocket, your prescriptions for that year. All right, let's get into the extra benefits of this policy. Acupuncture at 40, chiropractic at 15. You have to stay in network. Diabetic supplies, annual physical fitness membership. So they still offer silver sneakers at $0 to any gym that's contracted with silver sneakers. We can easily look that up. Podiatry is at $40. Home health care, you have to stay in network. It has to be approved by your doctor. And you do get a $60 quarterly allowance for their over-the-counter benefits. And yeah, it's going to be at CVS stores in store or by online. So I can help give you those links so you can utilize that benefit. Okay. All right. You do get a travel program with this HMO, except in the state of California. It allows you to remain in your plan for up to 12 months. So you can travel throughout the United States up to 12 months, have a national network outside of California, of course. So that's an added benefit. So you do get a national network with this policy if you decide to go with it. So in comparison, I'm going to pull up the Value Plus for the Golden Triangle, and then for Harris, the Value Plus, just to compare those, because this is the main policy offered in Southeast Texas. Okay, it covers every county in Southeast Texas, just about. Right. Oh, Harris, and what is this? Signature PPO. All right, so this is New Girls policy. The Value Plus PPO for the Golden Triangle, it does not cover Harris County. I'm going to go over Harris County next. You have got, first of all, here's the plan service area. Yeah, so just basically the Golden Triangle in a nutshell. You've got a $4.80 monthly premium, no medical deductible, and a $6,750, which is the exact same maximum out of pocket as that HMO I just showed you for in-network. If you were to happen to use your out-of-network benefit, so for example, for you in Beaumont, if you were on this policy and you were going to go to Houston, they're going to be charging you the out-of-network. So your out-of-pocket costs are going to start going to the combined maximum out-of-pocket number of $10,100. Again, that's going to be your financial cap though, medically. Okay, so the PPO is $440 per day for days 1 through 6. That's 2,640. So on the HMO, the max was $1,750. That's almost $1,000 difference on your inpatient hospital stay. The outpatient hospital observations, surgeries are higher. So on a PPO, you're going to see higher out-of-pocket costs, anywhere from $50 to $100 on any given service. Primary care is 0, specialist is 65. That's yeah, okay. I think it was 40 or 45 on the HMO. Preventatives are 0. Same numbers on the HMO and the PPO for emergency, domestically and abroad. Diagnostic tests and procedures, $40 copay. Yeah, so this is a little bit higher than the HMO, but again, on PPOs, you don't need referrals. It's just the same on the HMO. It's a little bit higher on the hearing outside of your annual hearing exam, and they give you a lower benefit for your hearing aids on the PPO. You get a higher one on the HMO. And you also get less dental on the PPO. So I think the dental was $2,000 on the HMO or $2,500. It's only $1,000 here for the PPO. Little bit less benefit on the allowance. I think it was $150 or $175 on the HMO. It's only $125 on the PPO. This is all the same for mental health. This is the same for skilled nursing. Any kind of therapy is going to be higher. It was a $35 copay on the HMO. It's $50 a pop on the PPO. Ambulance, $340. That's all the same. This is also the same on your deductible for the PPO for your prescriptions. It's $615. It applies to tiers 3, 4, and 5, and you're looking at the same co-insurance and the same out-of-pocket cost on the HMO. Let's look at added benefits. Oh, $15 per quarter versus what was it on the HMO? I think it was 60, 50, I don't know, something. So significantly less to use the over-the-counter catalog benefits. $15 per quarter. Acupuncture, much higher. What's 50 on the HMO? Chiropractic's the same. That's the same for diabetes supplies. Same for silver sneakers, 0 to everyone. So that's a little higher. This is the same as the HMO. And you still get a travel benefit on the PPO as well. Okay, so in a nutshell, the main difference between the HMO and the PPO, you're going to pay higher out-of-pocket costs on the PPO versus the HMO that's offered all over the Southeast Texas region. And you obviously don't have out-of-network benefits on the HMO. And you're going to get a little bit more richer benefits, not too much. Really just with the over-the-counter catalog is really the only difference between the HMO and the Golden Triangle PPO. I'm going to go ahead and go to the Harris County PPO Value Plus to pull that up real quick in comparison to that HMO that I showed. There it is. So this is the Value Plus in Harris County only. I just want to see what it looks like in comparison to what we've seen. Okay, so it seems this is only Harris County, but this is the other policy that likens to the Value Plus and the Golden Triangle. Not that you girls can get on it, but I'm just curious try to stay on a note here. Try to not make it hard. Same premium, same max out of pocket for in-network, less out of pocket for combined. Let me make that bigger. That's too big. $10 higher per day rate on the inpatient hospital stay for Harris County. Yeah, it's about 10, 20 bucks higher than the Golden Triangle one. Not that y'all can get on this one anyways, but so are you looking at about the same benefits? If you're restricted to only Harris County on this PPO. Not that that's a bad thing, obviously. Center. $0 for primary, 50 for specialist. All these numbers are about the same. $10 difference here. Yeah, there's only like a $10 to $50 difference between all these services. $500 per ear hearing aid, $1,000 for dental. It's the exact same. Same. Bet you the drugs are the same. AR. Extra benefits. Yeah, $15 per quarter.
$15. That's a big difference from 75.
Yeah, it is. All right. Yeah, so it's exactly the same policy as you're offered in the Golden Triangle, except it's a little bit higher and it's restricted to Harris County. Again, that wouldn't matter if you live in Houston. What is this? Okay, that's y'all's plan. So right now, all right, so this is, let's just take a look at this. Going back to the Golden Triangle. This is the other PPO offered. No Harris County. So if you want to be able to go to your Houston doctors and the Golden Triangle, you got to get on the HMO, or you're going to just pay a higher cost out of pocket on your PPO. Food for thought. Doesn't matter, whatever your preference is. Because again, most people, typically use whatever providers locally. They don't really want to travel, but sometimes it's necessary. So in comparison to the Value Plus for the Golden Triangle, you had a $4-something, like $480 per month premium. This is $0. You have no medical deductible, same max out of pocket cost. This is like 10 bucks higher. Okay, trend. If you have a $0 premium, you're going to pay higher out of pocket cost in your policy for each benefit. It's going to be 5 to 50 bucks higher. Here it is. On the Value Plus PPO, I think it was like $440 per day. Per day is 1 through 5, or it could have been a little less. But here you are, it's higher. It's because you have a $0 premium, even though the premium on the Value Plus is only $4.80 still. That's how it works. So it's going to be higher for the $0 premium PPO offered in the Golden Triangle. A little bit higher, again, anywhere from 5 to 50 bucks per service per benefit. Yeah. $60. That's, I think it's 65 for a specialist on the Value Plus. Yeah, all of this is about the same. Diagnostic tests, radiological exams, MRIs, X-rays, CAT scans, all that. Only $500 per ear. And no dental. So you get no comprehensive dental on the $0 PPO. 125 allotment for vision. Same on all policies. Skilled nursing, same on all policies. That's the same. Drugs are going to be the same. $615 deductible. You might see a difference in the tier 3 from 22% to 24%. from one policy to the next. That's about it. It's all the same. Same. Silver sneakers still offered. And you do get a travel benefit. So basically for the Golden Triangle, you've got the value PPO plus policy and this here policy, what is it called? Signature PPO. Main difference, a little bit higher in copays, $0 premium. It's about the same outside of that. No Harris County on either one. Okay, I'm going to shut that down. I'll leave that up for a minute. And then I'm going to go over the PPO that's offered in Harris outside of the Value Plus that we went over. This one, I think this is it. This is the other signature, but it's only offered in Harris County. It's going to be the exact same as what we just looked at for Golden Triangle. I can guarantee that.
There's no little, but I'm. Oh,
Just
there
for
is.
that, I'm probably just going to skim through this very, very quick. Oh, wait, my bad. This is not signature. This is called the enhanced. Okay, hang on. Let me make sure I'm looking at the right thing here. Yep, only for Harris. Let me make sure it has drugs on it. Oh, lovely. Yeah, it does. Okay. Okay, so let me go over this for Houston folks. Your other option for a PPO, only restricted to Harris County. It's called the enhanced PPO. So again, reminding you that the trends are, if you have a premium, typically you're going to see lower out-of-pocket costs within your policy. So let's see if I'm right. Pretty sure I am. Monthly premium, $45. Oh, that is a high, is $9,250 for in-network max out-of-pocket. It was $6,750 thus far. And then higher on combined out of network. I wonder what the deal is on this. Let's see. That's higher. That's the highest I've seen yet. $475 per day for days 1 through, well, I kind of trick you on that. 475 times 5, 2375 max for your inpatient hospital stay. But still, this is higher. We're seeing numbers on other policies for Aetna anywhere from 300 to 450. So far, this is a bit higher than the rest for any kind of hospital surgery stay. Okay, $0 copay for primary specialist is 40. So far on PPOs, we're seeing 60 or 65 with Aetna. This is a little bit lower by $15. Emergency, domestic and abroad. This is about the same for diagnostic tests, procedures, labs are the same. This is around average, the same as every other PPO, regardless of Golden Triangle or Harris. And for that matter, the HMO, for that matter, that's being offered for all of the region. So again, it's just a difference of anywhere from $5 to $50 to $75 in copay. Only $500 per ear for hearing. Only $1,000. Same on every PPO that Aetna's offering. $175 allowance for your vision. Okay. Same on inpatient mental stays. Skilled nursing is the same. Physical therapy is lower on this policy. It was 50 on the other PPO for Harris and for one of the other Golden Triangle ones. Drugs are going to be the same. $615. Yeah, 24% for tier 3. That's all about the same. Silver sneakers is offered. That's all the same. And you do get a travel benefit. So no over-the-counter catalog benefit on this one. Okay. What other policy do I need to go over here? only one more really. Harris County HMO only. And then I'll wrap it up and give you my thoughts on the matter. Yeah. Alrighty. What is this one called? Aetna Medicare Prime Care HMO. Only for Harris County. $0 monthly premium. No medical deductible, $4,200 max out of pocket. I think that's the lowest we've seen yet. $335 per day for days 1 through 5. So again, all of this, it likens to the HMO that's offered for all of Southeast Texas. These numbers, your out-of-pocket costs for any kind of hospital stay, surgery. 0 for primary, 30 for specialists. It's a little bit higher. It was one, excuse me, 130. Good Lord. 130 on the other HMO, I believe. It's all about the same though. I think the max was 30 on the all region for x-rays. Again, it varies in copays, not too much. Okay. So on the HMOs, you're getting higher added benefits, right? So on all the PPOs, you're only getting $500 per year for hearing aids. You're getting $1,000 per year on the HMOs. You're getting higher dental. You're only offered $1,000 on the PPOs. On the HMOs, it's $2,000. On one PPO doesn't even offer dental. Getting higher for your vision benefit. So on the HMOs, skilled nursing's the same. Therapies are cheaper on the HMOs. So a couple of the PPOs are 35 or 40, but HMOs are at 35. It's a little bit lower. Everything's going to be a smidge lower on an HMO out-of-pocket cost. Okay, now look here. This, you see how that deductible ranges? This is for the Harris County HMO. You have a $300 deductible for tiers 3, 4, and 5 versus on every single other plan offered in that region is $615 for tiers 3, 4, and 5. You're seeing a smidge higher percentage though on your tier 3, 4s, and 5s for co-insurances. $45 quarterly allowance. It's all about the same. There was a little bit of variance there. Same. Silver sneakers offered. Do you get a passport with this? I don't see it. I go over it. No, I don't think you get a passport with this one. Travel. Yeah, no. So no travel benefit for the Harris County HMO. Okay. So that's all the plans offered in Southeast Texas. So again, let me just recap this, and then I'm going to ask you girls to just kind of chime in on your thoughts, because if you guys are thinking it, someone else is going to think it when they watch this recording. But so again, in a nutshell, just a quick recap. 3 plans offered in Golden Triangle, 4 plans offered in Houston metropolitan area. 1 HMO, and that's this one, covers all of Southeast Texas, Golden Triangle and Harris. It is, in my opinion, after just reviewing all of the policies, including the PPO, the stronger policy out of all of them. If you still do an HMO, just know that if you're on a PPO, whether you're in Houston or in the Golden Triangle, you're not going to be able to go to any doctors without using your out-of-network benefits. Again, not that Houston would want to go to the Golden Triangle, clearly not. But more for Golden Triangle people, if you want to go to a Houston doctor, you're going to be using the out-of-network benefit. So you will pay a higher cost to see a Houston doctor. If you stay on the PPO, wow, my shoulder's hurting. Don't know what happened. Oh, just moved. I just moved. Let me not do that. Okay, and then on the PPOs, you're going to get less added benefits, so lower over the counter, higher copays. What else? You still get dental, lower dental. You typically get a travel benefit, except for one of the HMOs in Harris. The last one I just went over, the $45 premium one. Or no, that was the PPO. Either way, if you want to stay on a PPO, just know you're going to pay higher costs across the board, whether you're in network or out of network, versus this particular HMO. We would need to look up doctors and medications to make sure that you're in network. And that's it for Aetna. If you don't like anything that I've shown you from Aetna, again, you need to go to my website, watch pre-recorded meetings for other carriers. And really, honestly, I don't want you to get overwhelmed. If you just want to book an appointment with me, it'd probably be best that way. Because as I'm learning these plans, I'll know what meets your needs just based on the fact that you're my client and what you tell me. And so I'll be able to, eliminate a lot more and just give you 2 policies to pick from to make your options easier. Last thing I'm going to hit on is just remember, if your plan is terminating, then you are eligible for a guaranteed issue special enrollment period to enroll into a Medigap policy. And again, we would need to talk about that in an appointment because there are commission issues with that area also on my end. And I don't work for free, so it is what it is. All right, so I'm done with Southeast Texas. Aetna, what are your thoughts? What are you thinking in comparison? Because you girls are on the Value Plus PPO and the Golden Triangle. It's been a solid policy the past couple of years. I know that, Donna, you said you're on an HMO or something, right?
Right.
I don't even know what you're on. I'm going to stop sharing, so I don't know, maybe possibly embarrass myself. Let's talk about the Value Plus, though, actually, first. What do you think, Arlene, in comparison to the HMO that I showed for all of Southeast Texas?
I want to know if I could stay on the same doctors if I did the HMO.
No, you can. You can totally stay on your policy. Absolutely.
Okay.
Yeah, you don't have to move.
Well, how much is it on the PPO if you go see a specialist? Because I have a heart doctor. I was just wondering what's the difference between this year and next year.
65.
It's 65 now, but
Yeah.
it was 50.
I think so. It was
Okay.
usually around that.
Okay.
Yeah. I do know that Aetna across the board, because they even raised it up here in Central Texas, I think to like a $75 copay for a specialist when it was like 50.
Okay. Well,
Oh, y'all are frozen. Let me stop recording.
it helps. It does.